joining us this evening. We have the great pleasure of having Cori Allen here with us tonight. She's the new head of Health and Human Services for Calaveras County, correct?
Yes.
Now, how many months now?
It's only been since April.
Since
the first
April.
week of
so
April.
There you go. Congratulations.
Thank
welcome.
you.
And one of the things I want to say, it's nice to see that they recruited locally, because lots of times, they'll do the search and they'll bring somebody in from, but you're just from south of the river, right?
I live right in downtown Sonora,
and
it's just a nice, simple ride.
Very cool. So were you Health and Human Services in Tuolumne County before? Is that?
Yeah,
okay.
my entire career has been in Health and Human Services.
Okay.
I spent 25 years working for the County of Tuolumne, and my position that I left was as a deputy director within that agency.
Wonderful. So how much better is it being in Calaveras County?
It's amazing. I'm not lying. No, it's really amazing.
For those of you, there's always the rivalry. Once you get, with the high school rivalry,
of course.
So you've been welcome.
I do.
Welcome.
I've been absolutely thrilled by just how warm people are. And it's so much more comfortable. There's a bit of a casual air,
right,
which I think really serves us well when we're working in government, because government itself can feel a little constricting.
Yes.
But I'll tell you, I've been having a ball. I come into the office every day, and the team is just so warm and kind. And I really mean that when I say that.
Right. No, there's differences. In Tuolumne County, your population centers are a little more clustered, right?
Mm-hmm.
You have a lot. For Calaveras County, you're really,
quite rural.
Yeah, yeah.
And in Health and Human Services, what I notice is that access for people is so much more important for us as an agency, as service providers, to be aware of that.
Right.
So access through transportation options and sub-offices where we go to the individuals, go to families in the pockets of the communities where they choose to reside.
Yeah.
So that's one of our key values that we've been really working from.
Bringing on as a new head, what would you like to see, as far as your goals, then 5 years from now, what would you like to see new for the department?
You go straight to 5 years.
Well,
and I start with a 30, 60, 90 day plan.
All right, yeah.
But, my first goal coming in was to really get to know the people.
Right.
In fact, I prioritized getting to know the first names and the real personalities of everyone on the team. There's over 200 people within the agency. Yeah. And out of a county structure where there's 500 employees, it's very important to me. I don't want anyone to feel lost. So my very first priority was to get to know people. I told them, I will get to know you before I will reach out and connect with our county board, because they've brought me on and they have faith and I will get there. And so that, I think, was really telling. And so every employee is having a one-on-one contact with me where I'm learning about what their core value is.
Right.
And we're seeing where we align.
Right.
And because everyone comes to the kind of work we do.
Yes.
People don't just come to the work because, one, it makes you a lot of money, or two, it's going to get you seen, right? It's because you have a true empathy around the human condition.
Right.
And so that's my very first priority, and it's gone very, very well.
To have real empathy.
To really connect with the individuals that are there, right?
Yes.
It's hard work, and it's taxing. And I know we probably don't want to have to go down this path, but we're in a global pandemic.
Yes.
It's taxing.
Yes.
And it's taxing throughout the divisions, regardless if they're even working in that realm. So the next goal has been to build an integration across the multiple divisions. There are several divisions within Health and Human Services. So if you think about it, it's any kind of work that impacts humans.
Right.
Their health, their well-being, their sense of safety and permanency.
Yes.
All of that is being addressed. And I believe that the work, if we're trying to do it in silos, that we're missing huge elements and it leaves gaps. So children, for instance, are in homes with elders on occasion or often. Mm-hmm. And I want my teams to be looking at all ends of the spectrum when they're in or around someone's home or helping serve them, either in any element of their lives.
Yeah.
So that is the second and key thing that we're doing right now, is a lot of strategic planning around how we can better integrate the services we provide.
Yeah. A question, I think, sometimes people from outside looking in, you see Health and Human Services, then you have other organizations like Resource Connection and that type of stuff. Mm-hmm. Now, I know your department's the largest single, fiscal block of the county budget. How much of that budget is a pass-through to assist other organizations like a Resource Connection or anything, or is your funding it was probably a poorly worded question.
Well, it's a complex question because out of all of our divisions, most of our divisions are passing dollars through. Federal dollars, state dollars. On occasion, that's required. So there are community-based funds that the intention is to pass through government.
To an NGO or something.
Yep.
Yeah, okay.
And what it does is it engages your community in the type of work that's being done on their behalf.
Right.
And so it's intentional that happens. And I can't tell you exactly how much or what ratio or percentage goes to the community directly.
But it is a significant portion.
It's significant because in the work we do, our key values are around engagement and lifting communities. And you best do that when you're engaging with the partners and the nonprofits that are out there doing the very same thing.
For people who may not be familiar with it, it says everything that touches human, but just what are some of the different sub-departments, so to speak, in your department? What are the different...
So within Health and Human Services, we have our Public Health Division.
Got it.
Mental Health, which includes crisis and case management. We have substance use and DUI support, so collectively behavioral health.
Okay.
We have Human Services, which includes all of your protective services for children and adults.
Got it.
In-home supportive services and your CalWorks programs, so cash aid and food stamps so that our community members have access to food.
Right.
There is Medi-Cal, so insurance supports. We have our Community Action Agency, housing, First Five, which supports children, all children ages 0 to 5. Mm-hmm. We have veteran supports, which is a huge important component of the support that we provide. We also work, I don't want to miss anybody, Public Authority, which provides a registry of in-home providers to individuals that are homebound for medical reasons. And I think that's pretty much everybody that we have got.
So you have to have a good working relationship with law enforcement, not only county admin, all the rest of the stuff, but law enforcement, all the way.
Oh yeah. The overlap is continual through most of our programs.
Right.
Whereas law enforcement partnerships, the partnerships with Mark Twain, with Dignity Health.
Right.
Yes.
Yeah. So you got nothing on your plate. You got nothing.
And can I tell you, I absolutely thrive in that environment.
Right.
But I couldn't do this work if it wasn't for the individuals that are there every day, including all those partners.
Yeah.
The work simply, you would get to a point and you would have to stop. And so, I love the partnerships here. And again, it is when we're talking about community and neighbors, everybody knows each other. Mm-hmm. So everyone's looking out for each other that I have found. And even in recruiting for positions, people are coming home.
Right.
And I'm thinking, you have all this experience you've gotten in Southern California or in other states, and we ask, well, what brought you here? It's home. Mm-hmm. So I love that about this community and working in this particular realm.
Yeah. And I guess does that help in doing your work as well? That it's kind of, instead of government to it's more like family to family type of stuff.
Absolutely.
Is that
Absolutely.
Yeah.
And the reason is that I think sometimes we think the word government and therefore there's a power position. My whole value system is based on shifting power to the community, leaving it with the community where it really belongs, and then partnering. Yeah. Because any one of us, and I'm going to articulate this, any one of us can and will find ourselves in need of support in some fashion at some point in the spectrum of our lives.
Yeah.
And I would say that most people don't expect it. Most believe that they will be self-sufficient, especially when we've worked so hard to achieve that. Mm-hmm. But we can never account for the conditions that may come into our lives.
Right.
And we all want to know that if someone is coming in to help us, that there's empathy around it, and that it feels like a brother, a sister, a parent coming in. And not an entity. Right. And that is something that I bring to this work. And everyone that's working with me has that value behind it. That when someone comes through their door, they imagine that they themselves would be entering that same door.
Right. Coming out of COVID, a little bit of a segue. Coming out of COVID, what are some of the ongoing issues? I mean, are you seeing, where have been some of the stresses on people? Where, coming out of this, where do you see, are you going to see, what ongoing stresses do you think members in the community, I mean, because I know I've seen some people that, yes, it's been a mass crisis, but there's some people that can't let go of it. They get in this little bubble to where they, they can't. I mean, what type of? I guess coming out of it, what do you see as far as the community getting back to a healthy state mentally and all the rest of that stuff?
Yeah, it's a big question, and there's going to be a transition period.
Yeah.
We won't know, will we or when will we have another surge?
Sure.
And so when you're describing it, I can see you even physically reacting to what people are experiencing. It's that fear about, are we going to shut down? What's the impact on my life? And in Health and Human Services, all of our divisions are experiencing the secondary effects of what COVID-19 has done in our community. The education of our youth.
Right.
Not being able to go to school has been significant on their mental health, their physical health.
Especially in fragile families, right?
Especially in fragile families where so many of the resources that were being accessed from food to other physical needs disappeared overnight. The contact that you have with other people, so the social connections you have, I don't know if anyone really understood just what a huge impact that would be.
Right.
But for many of us, we saw our own children at home not getting out of bed until late afternoon because they didn't know what to do with themselves once they got up.
Right.
So the impact on mental health and well-being across the age spectrum, from pre-kindergarten through our elders, huge. We have peer supports that happen in our adult services unit who all day long, they're on the phone just connecting with individuals who have been isolated. And thank goodness for that division who's made it there, just because otherwise you're either going to get scammed or you're going to fall into a depression.
Right.
Our mental health agency, our behavioral health, never stopped. They couldn't close their doors.
No,
and thank goodness they serve over 1,000 people in Calaveras County. That is a significant amount of people that needed contact. There were some things that had to change a little, right? Now we're working with masks or we're using telehealth. It changes the dynamic. But thank goodness that we had committed individuals that knew this is not the time to shut it down. Right. It's the time to open it up.
Yeah.
Public health had to pull from a very small group of about 25 people and basically shut down daily public health operations and shift on a dime. They're still almost 100% in COVID response.
Right.
Because just when things got reopened, as anticipated,
another
things start jumping.
Up and
we're at about 13 active cases today. So, we're just really hoping that we can shift back into tobacco prevention and other health prevention things that truly impact our communities.
Well, that's kind of what was coming out of the COVID is are you going to see, does the needs base of the population look different now than it did before it went in? As far as, are you seeing a different problem distribution model than what you had pre-COVID? Is it?
And that's a great question, because it's one that we're not yet gonna know.
Right.
And what's tricky is things like referrals for protection of children. When you don't have children who are out and about so that they can have access, right?
There's a lot of stuff that slips through the cracks.
There's a lot of stuff slipping through the cracks.
Yeah,
and so we won't know what those sort of hidden impacts are. Violence in homes against other loved ones. You won't know those until everything is more activated in their lives. And that's happening now.
Yeah.
But it's a little early to say what the impacts are going to be. Right. So, but we're prepared. And and the team has been just sort of keeping an eye on that.
Needs for your department. What are you looking at? I mean, is recruiting and everything else tough for your department as well? I mean, how are you as far as staffing and stuff?
Staffing's tricky. Right now, we've got several open positions, and when I look at the trend to see about applications coming in, they're all trending low. So nurses in behavioral health is a huge need, as is nurses in public health. And they're two very different functions, but it is such a need we have. So that would be something I would really love to message out there. Social work positions are available across the gamut.
Okay.
And but yeah, several openings at the moment. But I do want to focus on the need for those nurses.
So you need nurses.
We do.
Yeah. What are some of the wins? So what's some of the? Because you always talk about the depressing stuff, so to speak. Do you have any instances? I know you're new on the job. Maybe should be a question asked in a year or so. Do you have any? The people that your workers, your caseworkers and stuff like that. Do you ever once in a while you get some wins?
Yes,
you get some wins.
Certainly.
Is there any that you can share or anything like that? What would be some wins?
I would say that right now, one thing that we're really actively working on is our housing plans.
Got it.
And what we do know in Calaveras County is housing is at an incredible shortage.
Yeah, it's hard.
We're unique in that we have more landowners than we do renters.
Right.
And there are not enough rentals for individuals who need to rent. So if you're recruiting for someone in a position, say a chef in a local restaurant, you may find someone from out of the area, and then that person may say, I'll take the job, and have no way to actually follow through if there's nowhere to live. So what we're doing with our housing programs and in concert with our community action agency is we're going to be shifting that team to a more public location where they can have a housing resource center. And it's housing first. And if you can focus on housing your workforce, you can have the double bang or benefit of improving your workforce.
Question.
Yes.
This is on that same thing, because I know from you've similar problem probably in Tuolumne County and also in Calaveras. How much of the housing pressure have you seen in the last few years be because a lot of rentals are being converted to Airbnbs? There's a lot of vacation. There's a lot of full-time rentals that have been converted to vacation homes. Vacation rental stuff. Do you see that?
Yeah, I haven't looked into that.
Okay.
I know that our housing manager has, and that's part of sort of looking at. But what we have to do is really look at if that is the case. If more rentals are turning into these short-term rentals, what other options do we have?
Right.
What creative things can we come up with? And then who do we partner with so that together we can sort of move into that direction? But having that model where we're really just focusing on any one of us could find ourselves in a need for more stable housing.
Right.
And truly it's a spectrum, right?
Yeah.
You've got just our grown kids who are coming out of college that want to come home that might have all the resources in the world except the space to move into. Mm-hmm. So we really want to focus on that. Focus on those that have the basic capacity to get housing and then help them find that, create those opportunities.
On that note, I know because there's been some funding coming from the state and some of the stuff. So as far as, are you going to be seeing worker housing as almost a different category than what a traditional homeless housing or something? Than somebody that has a substance problem or something that makes lodging a chronic problem for them. Are you going to start seeing where workplace housing and stuff like that is a kind of a new and distinct unit, or
what we're going to see is it's a spectrum of. So imagine 6 levels. Imagine a credit report. Right. So if you were to come in and I was to do a credit report on you, you'd have a score.
Yes.
What our housing team does is they are using this evidence-based tool that's strengths focused, and it gives someone a score. A housing score. And if they rate at a certain score, then they have what's already the basic skills to maintain longevity in the housing opportunities that are provided.
Okay.
And that's why I use the example of our grown kids who have been off to college and maybe come home. They've established a certain set of skills. And so, sure, there is a spectrum across about 6 levels.
Sure.
And our focus right now is to really work with the successes. How can we get to quick success?
So if somebody, use the chef for an example, say somebody comes in and says, hey, I've got a job, I'm supposed to start next week, but I got no place to live. Type of, is that a question that somebody should come in and ask for help on that? That
would be, and
okay.
It would be where we could start finding partners who are interested in either building something that is for a lower income price range, but lots of different options that can come when we've got these conversations happening. And we're very early on in these discussions around, let's get these partners together so that we have individuals to pair with when someone says, I have a space, and someone says, I need a space.
This is probably beyond the scope of this, but from the state level, has there been increased funding for maybe even things such as to be able, put in a mother-in-law quarters or something like? I mean, is that some of the stuff that
is some of the conversation that's happening? Yeah, and it comes. There's so many partners that have to come around the table, right? Because you have permitting and infrastructure.
But haven't they kind of opened the doors for more? Because even 5 years ago, putting in a mother-in-law quarters was, almost it wasn't going to happen. But now they've basically opened the doors, and there may be even some subsidies to even do it.
And that's something that we want. We're very curious about for sure.
Yeah, is that something that you're maybe assigning a staff person to that's to follow this type of stuff?
Well, we do have our housing and community services manager, and she has brought on 2 Civic Sparks, which I don't know if you've ever heard of that term. I hadn't. It's like an AmeriCorps or a Peace Corps member.
Okay.
And their job is to help with sort of housing opportunities and community development. I'm impressed by her capacity to bring in people, graduate degrees, in this very work. So we do have curiosity around it, and we're starting early conversations.
Question, because sometimes people in need on that, especially if their life is unstable to begin, is the path of even going down the process maybe seem too daunting for them. Is that where some of those people would be able to basically help them down the path? Because sometimes, people get to a point to where even the fact of that there's something maybe available to them, they wouldn't avail themselves of it just because the process of doing it would be too onerous.
And that comes back to your spectrum of needs.
Right.
So if you're doing a housing readiness scale, you may find, also some budgeting education.
Right.
Also some job training.
Yeah.
And that's the services element. And yes, there's a services component that comes to that when you're looking into that particular grouping of individuals that we would serve.
Okay. All right. Other areas of interest. I mean, what do you think? What other areas of interest do you need to highlight? What type of things?
Ooh, great question. I think at this, we've talked, I was telling you earlier when we first started that as a small rural community, really getting out to the public.
Yes.
I've been pleased. Our CalWorks department has had these satellite locations. We just are reopening 2 of them, and they're in the more rural areas of our community. I think that's critical.
Yeah.
So these outstations, someone is there 1 day a week, so that a person doesn't have to come all the way into San Andreas if they happen to be outside.
So those, you say West Point, Copperopolis, or
exactly.
where were those? Where are those?
Those 2 locations.
West Point and
I
Copper?
believe there's one in Mountain Ranch as well that's still being looked at and I believe reopened. So having those opportunities for people so that they can connect is good.
Yeah.
Right now, our health department is doing, in fact, this evening and yesterday evening, health fairs at local schools in collaboration with the Calaveras County Office of Education.
Yeah.
And that's really been incredible because they're also bringing, and as we talked about integration, some of our CalWorks staff. So if people need to apply for CalFresh for food, then their children could be eligible for a free lunch at school.
Right.
All of those things are happening at once.
Right.
And they're getting access to health education and information as we get ready for that back to school time, especially with schools going back in person. So those are important. And then I think I want to tap on our cooling centers.
Yes.
So the Health and Human Services Agency is responsible for making sure that we have that when there's a trigger.
Sure.
Those triggers happen when certain weather notifications come, and it's when there's an extended period of time, 72 hours, of a particular heat point.
Yeah.
And so we have individuals on team that regularly track that. As soon as we get the information, we work with our Office of Emergency Services, and then my team will staff those cooling centers. And we've come back to a one-center model so that we can really bring the resources to one space, but we provide free transportation for anyone that
Calaveras
needs it.
Connect to bring them to and run to the. And that was the library. This last.
It was
one,
at the
right?
library.
Yeah,
It was
last
wonderful.
Question. I know this ties into the little bit of the cooling center thing. Will that be similar model if we have a fire event? Are you guys going to ramp up? What as far as does your department come into play as far as evacuation centers and stuff like that? As far that?
Yeah.
Okay.
So our public health division is responsible for the emergency. So we have emergency preparedness staff. And they activate certain components of a disaster, right?
Okay.
And my staff within human services, so that's your social services, are responsible for staffing a mass care and shelter operation.
Got it.
In collaboration with Red Cross and FEMA. So what it does is it provides a local disaster service worker core that's right here and ready. So tomorrow, the team is starting their training to get ready because we're in fire season.
Oh boy. Yep.
And so they'll get trained on how to set up their mass care and shelter. And we want to be ready for when these things occur.
Yeah.
All of the staff is being trained in the incident command system so that everyone understands and falls in line. And so this, I think, is going to be a year where we're going to have a lot of readiness around that.
Yeah, I hope. I'm.
Yeah,
it's
we're doing
July
a lot of
now.
let's
Yeah, because if you
avoid-
look at what happened to our neighbors to the west, you figure their county seat was overrun, so their evacuation shelter is actually in the state of Nevada. They're running. So Alpine County, since Markleeville was overrun their evacuation center, and actually their county government seat. The temporary seat was actually moved to Douglas County.
Yep.
So it's actually moved to Nevada.
And we prepared for those situations with disaster preparedness. And so that's exactly why we're doing these exercises. Right. And Red Cross has been coordinating them, which has been amazing.
Yeah.
Because they also run these tests to be sure that we're ready.
Yeah.
And all the resources are available. And what's awesome, too, is that each of our divisions has mutual aid agreements and understandings.
Right.
So for Amador County, or as Alpine County, in this instance, Calaveras County can run and do their food stamps and their CalWorks applications for them. So a person, if they were in this area, could come into our office and we would operate just as if they were in their home county.
Wonderful.
And that's just one example that happens throughout our divisions.
We're getting down to our last minute,
okay.
And for a little bit of summary, welcome to the county, welcome to the area. What as far as a little summary on HHS, and what would you little minute summary here? I
would say that I'm just thrilled to be a part of a team that has been so adaptive during times that no one could have envisioned.
Right.
And what we're doing now is preparing for the transition out of COVID-19 and providing health and human services throughout our community that meet people where they are.
Thank you. Thank you, Cori.
Thank you.
Appreciate it.